ladies and gentlemen, now it's time to have a panel discussion. Like we like to invite the three speakers up to the podium. We'll put up some chairs like to line up with the cameras because this is being webcasted. And also I would like to invite on a couple of other others from the from International Institute of Health Sciences, the organizers of this session. Ms. Dilum Welivita, a registered nurse who practiced for long years in the United Kingdom. She's a graduate from there as well, and who has a lot of experience working with information systems of the NHS. And also Mr. Tharindu Dushyantha, a graduate nurse, and probably the only nurse in Sri Lanka who's involved in learner management systems and virtual learning environments probably for the last 4 years, as I understand. So like we'd like to have a panel discussion involving these panelists plus many other key people in the audience as well.
Well, it's time to take up some questions from the audience.
Till some questions come from the audience, like to ask a couple of things. We heard a lot from the speakers, but let's hear a little bit from the others as well. Ms. Dilum, like with your experience in the United Kingdom and with your involvement in with the local nurses, like back here in Sri Lanka again, how can a nurse who's trained in a traditional environment be transformed all of a sudden into an electronic environment? If you take one of our nurses and go and put her to work in the United Kingdom, what would it be like?
Good question, Dr. Ishan. Thank you for giving me this opportunity. If I recall my memory with nursing in UK, so what we do in UK is like basically nursing informatics is part of the nursing curriculum, and we train them from the day one in the university. So it won't take that much of time them to get used to the system when they really start practicing. I think that's make a huge difference. That's something you have to think about in adding into the nursing curriculum here. And also I can remember now, like those days we used to take the drug trolley to patient. Instead of that, now they're taking cows mean computer on wheels, or the iPad. That's how the system is there now. And also like almost major hospitals, they have gone paperless. Everything from the care plan, nursing assessment, ordering, medications, everything we are using the informatics there. And if anyone, or we are thinking to move into that stage, so we have to start from the curriculum level here, train them from the day one. Because Ms. Nadeeka have mentioned a question which is really good. Actually, I felt, but no harm. We have certain priorities in Sri Lanka. There are so many things need to overcome before we come into the informatics. But it should be no harm done if you learn and if you can put your hands onto the informatics and learn it and move forward. Otherwise, we will not be able to fill or match the gap where the UK and Australia is now currently. I believe you also agree with that, right?
Yes, sorry. I just wanted to add to that because I did forget to mention with one of my slides and around curriculum. One of the drivers for UTAS to embed informatics across our new curriculum is that we're very aware that the Australian Nursing Council that governs our practice is releasing some new standards in 2016, and as part of those new competency standards for nurses in Australia, informatics is definitely going to be written into those for the first time. So we believe that we'll be one of the first universities in the country that actually will comply with the informatics requirements of the new standards of nursing.
Let me add certain points onto that comment. Looking at how to train the existing nurses on informatics, and of course we have some academics here. They would look at how to add that into curriculum, which is not there at the moment. So those are some of the areas that they are looking at. Of course, CPD, the Continuous Professional Development Programs, is mandatory that you look at nursing informatics as a program.
We can have some comments from them as well. We would kindly like you to introduce yourself and add some comments.
I'm Dr. Sudhakar Surya, present coordinator at the University of Jayasinghe BSc Nursing program. I have several questions I noted down while you are doing the presentation. First thing is, I'm not clear, this is a new area for us. In our program, there is no such a module or curriculum content for nursing informatics, but we give IT education during the degree program. That means they know how to do the thing. The student also use this smartphones and all the computer presentation or other assignment they do in using the computers. What is the informatics and also the medical informatics? The same thing you.
Health informatics is a large umbrella where within that you have public health systems and hospital health systems, and within the hospital health systems you have the nursing informatics coming within that. Some would go into public as well, but originally the total process would start from the nursing arena. They are the ones who do the nursing care process. So this is supplemented by the medical consultant support as well as medical officer support. So it's a grassroots level care plans, as well as the total assessing, the nursing care process that was aligned with the nursing informatics. But it has gone to many other areas as well. It's gone beyond with the technology. They have gone into different levels of provision of care at lowest cost with the highest quality. Did I answer your question?
And a comment from the delegates from Nursing Council as well.
Thank you very much for giving this opportunity. I think this workshop is very valuable for us. I think as nurses, we should apply this knowledge in nursing informatics into our nursing practices. Nowadays, we help to do curriculum revisions. Therefore, we can add this subject, I think, into the nursing curriculums, and it will help to introduce this subject to the nurses.
Thank you very much for your comment. And since there's a lot of talk about education, Mr. Tharindu, would you like to comment on, with your experience with the diploma and graduate level nurses who are engaged in learning through the distant learning modes, the online distant learning modes, the learner management systems and the VLEs, how receptive are they? Are they okay with it, or are they comfortable with it?
Thank you, Dr. Nishan. I think I see a clear gap between what has been delivered through curriculums for students and application of those skills and knowledge in terms of IT, information technology, where there is a clear gap. Because most of the time what we see is nurses, or like mostly even in any other health fields, where they do have IT literacy. If like honestly speaking, if you ask how many of you have Facebook accounts, like most of them do have Facebook accounts. But the problem is how capable of them using their IT literacy for new applications and innovation, or for any other purposes. I see a clear difference. I mean, like a gap between what they have been doing and what they're supposed to carry out. Where from my point of view, I like, even when it comes to healthcare systems, so nursing informatics, or HIS, hospital information systems, I see some hospitals, we do have currently hospital information systems, but I have the doubt how much do they utilize these facilities. Because if you look at most of the private sector hospitals and all, like they do have hospital information systems, but the thing is, like, I don't see people using it much. So my opinion is, I see two problems with regards to this. The first thing is problems with so it's not that implementing the hospital information system and then trying to train people on that particular application or information system, but that has to be integrated to curriculums. And that again, not only for nurses, but for any other healthcare professional, because like, though we call it nursing informatics, and but if, as Dr. Kithsiri mentioned, that is a huge or vast area, that hospital information systems, where other healthcare professionals and nurses are put together and interact together through information systems to make client care delivery effective. So where I see that the nurses and other healthcare professionals has to be trained on IT, basic IT literacy, as well as usage of these applications in healthcare arena to make it effective. The second problem that I see is, well, again, as Nadeeka questioned during the last slide, that is that the priority? I guess like that is one of our priorities, because we see plenty of medical negligence which has been, like, you know, which occurs again and again, and certain things are very simple things which can be avoided or prevented very easily. So I think, like, for an example, if you look at a medical prescription, if you do that through a system, let's say you mark client is allergic to paracetamol, and then like a doctor or nurse prescribe the medication, if a pop-up comes saying it's allergic, so how convenient that will be. So that is where I think, like, you know, that is the real beauty of health systems. So, well, as Nadeeka mentioned, the problem is not the priority, I guess, like how we are going to put it into practice. Because what I see, we do have hospital information system, nursing information systems, but then again, we have the system, we maintain it. Apart from that, we do have the manual things as well. We keep, like, you know, all the other records. Why this duplication? So then the nurses or any other health worker would look at it as a burden. Why do we repeat? I mean, that is one point that you, like, I think as people from healthcare background, as well as informatics, so we should be looking into.
Thank you very much, Tharindu. And there's a question from I'd like to introduce the one who's going to ask the question, the vibrant General Secretary of the Health Informatics Society of Sri Lanka, Dr. Chaminde.
Thank you very much, Nishan. My question is also quite connected with the earlier question, like whether this health informatics, medical informatics, nursing informatics, then how many informatics will there be? Shouldn't it be able so produces a device, they don't send a manual with them, because it should be intuitive. You should be able to, if you have a general IT background, you should be able to use it without formal training. I think when we have informatics, we should have all the people as stakeholders and deliver larger the hospital information system rather than compartmentalizing this informatics, and people ultimately might fight over what's my part of this, and like so we have to promote from the inception that these are multidisciplinary things that everybody who is a stakeholder should get together and work together to improve the health ultimately, because nothing is about eHealth or informatics. We are looking after the health of the citizens. That's what I have to say.
Thank you very much for that interesting and a challenging comment as well. Would the panelists would like to add something to that, or anyone? Or like to any of the comments that's been going on?
This is for the nurses who are currently practicing. I would like to say in UK also we really find very difficult to implement at the first time, because who are existing nurses, we have to send them for a special training, and it costs quite a lot of time. But believe me or not, it will save a lot of your time, and which we can use it for the patient care and your critical thinking, clinical decision making, rather than writing documents here and there. So I really believe if you can really getting into it, like your time will be more saved, and especially nurses are quite famous to say like we don't have time to do this and that. So then you will realize you will have a little bit of me time for everybody. Thank you.
Thank you. I might just add to the question, and also what you were talking about nurses not having the skills, the IT skills that they need. It's actually true in Australia. There are assumptions that the nurses are proficient, particularly the younger generation, and perhaps they are with some aspects of it, but not all. And so we can't assume that they have the basic skills that they need to work in that environment. Back to the question at the back of the room, I agree about that. It should be for all. The informatics and the technology that we use should be generic, and so that everybody working within the healthcare sector, whether it's in Sri Lanka or Australia, should have the basic skills to use the apps or the programs that are there. Linking that back to training, I suppose the challenge then for training organisations or curriculum providers is that what is a generic enough space to start that IT training, so that we can then apply it to most of the technologies and apps that we're using. And then that begs the question to the people that are planning, and we've heard a lot in the last few days about the strategy, the framework, the architecture. So it's not just about how we teach people to use it, but what we need to be doing is putting the architecture around the design that gives a generic platform that's easy to teach across disciplines.
Any more questions or comments from the audience?
This is more of an observation rather than a question. Coming from a background where the nursing practice, the medical professional practice, is governed through some very strong compliance infrastructures. clinical governance focus. So then translating education into actual practice becomes that much more structured and probably achievable. I'm just thinking in terms of Sri Lanka. It looks nice to have the nurses educated offline with courses and so on. At the end of the day, at the bedside, it needs to translate into a behavioral change and a practice, and it should be consistent and reliable. How do we do that? So I think the commitment must come not just from the nursing, but from the whole medical fraternity within the hospital, which governs it, monitors it. People respect things which are measured and monitored. So I think that's the transformation that Sri Lanka needs to do in parallel with the educational growth. So that's just my comment. And that's the challenge, getting everybody conformed.
Thank you very much. I think Professor Tony Sharma's first things in the list of 10 was leadership. So maybe Dr. Kithsiri would like to add something to that comment on how to go ahead with this.
This is aligned, not really aligned with the informatics, but it's a general comment where, of course, we are replacing the caring hands with some devices. It was mentioned in many few presentations. Where would the caring hands would go? Not only nurses, but the medical fraternity as well. Day in, day out, we see the patient loads are immense, and specializations are growing. So instead of a general physician, you have a specialist in certain area, endocrinology or cardiac. So they would see only a specific patient. So their times are limited time. So that's where the nurse would have to absorb of that the deficiency in care. In terms of the ethics and regulatory norms, they are there. They have not been changed for centuries. It has not been changed. But implementation of those will take loads of time, because as administrators, they are bounded by, especially the medical administrators, they have so many limitations in terms of at least controlling or coordinating among these high-end professional bodies. That's a challenge, day-to-day challenge. But I think the nurses will have a role to play in this arena to fill that gap in.
I think though the discussion is very fruitful and interesting, we have run out of time. We are already 5 minutes late, 6 minutes late. There will be a lot of other activities happening in the main hall. So I would like to conclude this session. I'd like to thank all the presenters and the panelists, and of course the audience, for their attentiveness and for the questions that they forwarded.